My talk is in line with all the beautiful software apps that we have seen so far during this COVID-19 pandemic. Great innovations so far. So what I'm going to take you through is a story of a product which we have been developing since last 1 year. And let's have a look at this. Imagine if a patient is able to send you a video and a photo like this from the interiors of his home and villages, sitting right there, and you're able to do a teleconsultation like this. Isn't that something that you would want in these times of lockdowns and saving the visit for the patients? So how did we reach till here? Now, when the lockdown started, as Dr. Padmaja mentioned in her Connect Care talk, there was a storm of patients who were sending us photos using their smartphones. So they had the means, but they lacked the knowledge as to what is exactly the clinicians needed to make a decision. As you can see, we had a lot of images coming in which lacked the clinical frame of interest, or there was a shake, lack of focus, inappropriate lighting conditions, and magnifications. As a result, 84% of images were not up to the clinical standard grade. So we analyzed up to 340 images and we did our study, and we tried to figure out what could be a universal solution which can be portable, a stable solution, a hardware as well as a software that can sit on any phone of the patient on their camera, and it will be on a secure sharing platform, engaging the patient to consistently send standard clinical grade photographs. That's where the idea of Grabi was born. So Grabi is basically a hardware paired with a software which is designed for patients to use from their home to connect with the doctors. So there was a team which was constantly seeing the standard smartphone images as well as the images clicked using Grabi, and comparing it with the gold standards of slit lamp with the best possible technology available, trying to standardize these images and all obviously taking the cost effectivity into the picture. So a design team, clinicians and support care staff, software developers, and many of the manufacturers and operations were involved with primarily bringing the patient into the focus. We compared our images with the gold standard of the slit lamp, and we found that, okay, there were encouraging results. More than 50% of the images showed that if slit lamp photo is 100% quality mark, we were reaching somewhere up to 60 to 70% of the images within the 90% quality of this gold standard images. Also, we could achieve a clinician acceptance rate of 60% with the initial trial run. So we devised a protocol by which we can fix this attachment to any smartphone, and we figured out the camera adjustments that can actually help a patient to get a good photograph. And we established this protocol and distributed these among the patients. And as you can see, there was a significant improvement in the quality of the images sent by patients from their home post-operatively. And this helped to save us their visits. Now, in the upcoming phases, what we are trying to do is convert this protocol into a software which will be able to directly upload these images and link with the EMR, and it will be uploaded in the patient's file, and also upgrade our hardware to a magnifier lens along with a standard illumination, which also has a blue LED for ocular surface staining procedures. With that, so these were the images that we obtained with the newer version, which is an effortless and clear documentation. It can document all the anterior segment findings very clear, so much so that you can also point out a loose suture at 7 o'clock. Now, we asked the patients to record videos, and as you can see, it was a seamless experience for them, smooth with no shake at all. You can actually make out the margins of the corneal ulcer. You cannot miss out a single corneal vessel in that whole scenario. And this was the difference that we achieved. On the left, you can see the image captured by just a smartphone. On the right, with the latest hardware and the software module. This is the same patient which I showed you in the beginning. He's sitting in the interiors of Maharashtra. We trained his son to capture the images, and he was able to send us the photos like this. This is a girl. We trained her father. She was affected by pythium keratitis, and luckily we were able to manage it during the lockdown when they couldn't travel to us using this device. We were able to give them proper management. Imagine a Down syndrome child who is very uncooperative, not allowing anybody to touch, but with the help of device and with the trust with his own parents, we were able to see that it was a case of hydrops, and we could document the findings very easily. So it had many advantages. So in the future, who are the players? Patients as well as doctors, as well as the primary healthcare workers. Everyone with a smartphone in the pocket are going to be benefited by it. And with the app, everything is going to be linked to the EMR. So with the latest development, we figured out that the confidence in quality of imaging was up to 70%. And we got it, the time employed in it was very less. So combined with the Connect Care platform that we have, as Dr. Padmaja mentioned, this could be the beginning of teleconsultation 2.0. And it has its advantages in standardizing the quality of imaging, decreasing the healthcare expenditure, and digitalization of newer algorithms on images. So this was the the product. So Grabi, which was made to save a visit for the patient. Thank you. You're on mute, Dr. Sen.
Sorry. Yeah. So you're muted. Yeah. Yeah. Thank you very much for that presentation, Dr. Vineet. You just elevated the level of care. And I do appreciate the fact that videos by patients is very difficult. They can take stills because they can kind of pinch it out and do that. But videos, we found it very difficult. So just tell me something. The hardware is a clip-on spacer, basically.
Yes.
It's a clip-on spacer. And it's compatible with all smartphones, the same distance for all smartphones?
Yes. We actually tested on all different companies of smartphones, and we figured out a distance that works literally on all of them. So luckily for us, ophthalmic imaging anterior segment, we get that depth of focus is kind of forgiving for us. So that particular distance works for most of the phones.
Yeah. So for the videos also, it on all smartphone platforms is the same, is it?
Yes. Video is more informative in all the ways.
We have been struggling to get any videos from our patients because when it comes to videos and they can't zoom it up and they find it difficult. So it's I think it'll be very relevant. Thank you very much.
That's the advantage of the app. We have pre-configured the settings. All they have to do is just tap.